We are all set. We are on.
Morning, thank you all for attending. It does seem like it's been the first broadcast meeting. Come on. Right, hope you all had a great summer. It's nice to get a little bit of the autumn in the air. You know, my name is Harrison Pierce. I'm the chairman of the Health and Human Services Commission. First item on the agenda, the approval of the July 11th minutes. Any questions, corrections? Thank you, Bob, for doing a great job. One little correction or suggestion I have is underneath this, we have, you know, under the minutes, this is not part of the minutes per se, but it's hybrid conference call. I think it should be, you know, special meeting minutes or regular meeting minutes. You know, we don't need the location of the methodology there. So, may I have a motion to approve, please? Sure, approve. All in favor? Aye. Opposed? Thank you, Barbara, for doing a great job.
You're welcome.
The next item, Health Department.
Jen Ileson, Director of Health. So I sent you all the reports with the numbers for July and August. In July, we also had to deal with FDA recall of the Boar's Head deli meat and an oyster recall. And then in August, we had, you know, the fun of the flooding downtown. So those were added on top of our normal inspections, and septic was extremely busy in July and August, which was fun out in the heat, having to deal with a lot of soil testing and installation of the septic permits. The FEP grant, we have the contract. I have to go before the Board of Selectmen. Hopefully that's next week. I did send it to Tucker Murphy. The board has to approve the acceptance of the $11,393. It's a slight decrease from the $11,708 we normally get. Every municipality in Region 1 and in the state had a decrease in that amount. Events, sent you all the data from everything. August obviously was lower than July because everybody's away. We have some upcoming events next Friday. Shannon and my nurse Ellen are doing a holistic health talk at the request of many, and that's going to be on the various trends right now of, you know, fasting, cryotherapy, cold plunging, saunas, all that jazz. I sent out through Everbridge to the health group. There's over 1,700 people in it. The Lunch and Learn event that Stay and Put is sponsoring again. They will pay for the luncheon portion of it, about osteoporosis with a local internist, Dr. Jamie Ruskowski, who we work with frequently. And that actually registration's already full and we have a waiting list. So it's a pretty good topic that everybody was interested in. And then with Dr. Elda Mole, the dermatologist we work with all the time, she's going to be doing the next Lunch and Learn with Stay and Put on skin cancer prevention, healthy skin, on Wednesday, October 9th. So that one I'll be sending out in a couple weeks. The trainings that we have to go to maintain our certifications. And then the charts of the data. So you can all take a look at the data of that. We're also preparing for flu clinics for October and November. And then again, if you're not signed up for the Everbridge group and you want to be for the various things, just let me know. I did send out yesterday also for the community, New Canaan Community Foundation, information on their public sessions where they're going to be seeking input on their survey, which is separate from the New Vance Community Health Needs Assessment Survey that's still open. They haven't closed it yet. I just mailed out last week the 50 paper copies that we got of that Waveney and Schoolhouse had completed. So that was mailed out. New Vance did tell me that New Canaan has the most responses so far, which I'm not not surprised, so. So hopefully we'll get that data this time and hopefully it'll be useful data. And then, I didn't think much of it. And this time they had zero input from all of us on the community health group, where before, the last time we did it, they had subgroups. There was a lot of time and effort put into it and of building the survey itself. This time it was, they just did it, winged it, and I don't know how much we're gonna get out of that. I didn't find too much useful information in it.
Didn't seem like it was really tailored to what would be important for us to learn.
No, that,
The big city.
Yeah.
well, they always tend to lean towards Norwalk, where New Canaan and Westport and Wilton that are a part of it are always kind of left behind. That's why it's important for the community foundation and us to support the community foundation's efforts, because that will be the New Canaan centric data that will be useful.
Agreed.
And I also posted the community foundation one on our social media page. So hopefully they get good response to the 2 public information sessions. I think I forwarded it all to you guys as well. So just get the word out to all your friends. So hopefully people will go.
I just signed up for your, well, you helped me sign up for your newsletter and it's great. I mean, whatever, it's your information, Everbridge, right?
Yeah.
Yeah, it's very professional and informative. It's really.
I was just gonna say, I thought this was terrific. My question is.
Um,
I saw
no,
a
you
lot of
gotta sign
bodies
up.
there doing lots of stuff. That's gonna be a surprise to our local citizens. How much of that is paid for by the state and how much is,
For what?
for the sustaining the salaries of staff? And all the things that they do.
State doesn't give us anything. Everything's paid for by the budget, and we're less than 0.5% of the town budget. We have a very small budget, the health department, in the scope of everybody else. You know, there's only 4 of us full-time to do all of this. And then we bring in, roughly $180,000 in revenue. So our permits help offset the cost. Where other departments that don't get, revenue are just costing the town.
Jen, do you go public with the recalls and where?
And we also email it all to all the restaurants and everything, but we go there and make sure that they're actually doing it as well.
Do you want to tell us where the oysters were?
Huh? It's a particular brand, a lot number that we had to look for.
Oh, right. Oh, and-
One of the suppliers, there was a problem?
Yeah, they give a lot number. That's why they're supposed to keep their shellfish tags.
Yeah.
So, you know,
And what was the problem?
with
With the
oysters, Vibrio, and with,
Yeah.
with the deli meat, boar's head, it's Listeria. I think around 10 have now died nationwide from it. So they're expanding the recall even more to all of Boar's Head, where before it was just certain lot numbers where they sent you the picture of, and the lot number of it. No, I don't think people realize, the importance in that food poisoning, you can unfortunately die, just like in the 80s, the Jack in the Box. I think so. I was a kid and I was born in 79, so I think it was the 80s.
Still a good memory.
Forgotten about that.
Jen, quick questions. Raquel Harrison here. On the opioid surveillance for New Canaan, there's 2 suspected overdoses in the age group of 1 to 4. I'm not sure that numbers jumped out at me before. I'm more probably just curious about like any follow-up that happens, or is that more on the task of whatever hospital diagnoses it? Like, how does that kind of
Yeah, 'cause-
play into things from like a probably securing medication, right? Would be my guess of like how these little kids are getting into it, but
Right, so from these surveillance data, they don't give us the patient identifying information because it's not a reportable disease. where, you know, with the flu or Lyme disease or whatever, we would get the actual patient info. On this, we don't get anything, not even an address or anything, just the age. But 9 times out of 10, I would say probably 99% of the time, it's getting into medication or even breastfeeding or something like that of how they, or just a parent accidentally over medicating when they're trying to, you know, not give the pediatric version of a medication, they give the adult version. But no, we don't get any of the patient information to be able to follow up on the specifics. And the hospitals don't put the notes of the details. So like you've indicated before, when they code something, it goes into here and you don't really get the backstory of it. So, which is always prevalent with the suicidal ideation, because they can code something multiple different ways and they may not necessarily be in the ED, you know, for that, but they could have said something that indicated and then they code it that way.
And it's your impression, or maybe Raquel, that the opioid overdoses are intentional or accidental? Because there's a big difference.
Well, I think it depends on where you are in the state, because obviously the cities have a massive opioid problem right now, and that's not just a coding error, that is truly happening. But in terms of New Canaan, I mean, and again, this is only like what actually happens. It's not what doesn't end up in the hospital. So people that abuse prescription medication, they may not see that as, you know, something that's wrong because it's prescribed, you know, opioid, but they don't realize they're heading down a dangerous.
But I don't think I don't think it can be linked to the suicidal kind of components. I think that was your question.
Yeah.
I think they're very separate issues. I've not heard of a lot
Well-
of cases where that's the choice of method. It's
I would-
complicated.
yeah,
question,
I
but-
would,
Hard to tease out the difference.
exactly. I don't think they're two separate issues per se.
Yeah, I mean, in my perspective, it's really just the idea of like, can we follow up on some of these potentially high risk
Yeah.
people, right? And like, that's just, it's tricky that we can't, right?
Right, because of the HIPAA patient
Right.
privacy laws, and these are not reportable diseases of that laundry list of reportable diseases.
You know, from a hospital perspective, you know, in the case of like child protective services would get involved if there was concern of like security of things in the home. But those are also oftentimes like best intentions rather than like, you know, from our side being able to follow up.
I would think, well, the hospital then, you no matter, just they contact the police and there's that follow-up with that.
Yeah.
That's it. Thank you, Jen.
Okay.
Human Services Department,
Good morning, Marcy Rand, interim director. I sent everyone all the numbers. I won't bore you with a ton of them.
Marcy, excuse me, are you on?
Oh,
Yeah.
no. Should I reintroduce myself? You got me, Marcy, interim director. I sent everyone the numbers. We are slowly inching up as far as clients, residents. I have 218, Jackie has 149 families, 158 kids in those families. August, I actually had a busy August, just not as far as like events, just as far as I had a couple meetings. I attended the Taste of New Canaan sponsored by the Chamber of Commerce. They were benefiting the food pantry. They raised $5,900 for us. So that is very exciting. I have had a lot of protective service cases. And I'm not really sure why, you know, it's gone up. So I had 3 home visits in August with protective services. I have another one coming up next week.
Adult or child?
Adult,
Adult.
yeah, I do the adult.
What's involved when you have a visit like that?
Well, we go in with a state social worker and we sort of take an assessment of like how they're living and how they're making their needs met. Sometimes it's elder abuse, other times it's, just sort of self-abuse and not taking care of themselves and not capable of taking care of themselves. And so the state actually, it's a small group of social workers. It's 3 social workers who have like from Greenwich to Bridgeport. I think it's crazy, but they really are very good at getting the services needed for these people.
Is there any pattern that you see at all from any socioeconomic group or anything that we should be aware of?
No,
it's
no,
not-
you'll see either children who are quote power of attorney, but living in another state and not checking in on their parents. You'll see there's a lot of alcohol abuse. It really ranges, and it doesn't matter, financially. It's all over the place. There's some hoarding, there's just some mental illness. It's all just dependent.
Follow-up question.
Yeah.
Richard. On the vulnerable population list,
Yes,
that looked like it was substantially lower than it used to be.
it was during the weather. I think I
Yeah.
said
I think it was in June.
meeting in June. I literally called everyone, and a lot of them were like, you know what? I was on that list during COVID. I'm 65. I am fine. I don't need you calling.
Don't
me,
call me.
So it went down. It'll inch up a little bit.
Yeah.
But it's good that it went down.
Yeah.
You can
Well,
say
it's
so.
very representative.
Very good.
It's really valid, representative.
Yes.
I mean, actionable.
Yeah. There was a pickleball event that Nicole Vartuli had with, is it the New Canaan Racket Club
Yeah.
over there? And all of her proceeds, she hasn't gotten the final amount yet, but all of those proceeds went to the DVCC, and that was really nice of her to do. I am continuing all of my Life Reimagined programs and my grief and bereavement group at Waveney, and that has gotten almost too big, which I hate to have to turn anyone who's bereaving away, but we now have 11 consistent members, and they are a cohesive group. Like I was telling Dr. Pierce a couple weeks ago, they all ask for each other's phone numbers and stuff. So I was away last week bringing my daughter to college, and so we couldn't have it, and a couple of them called each other. And
Oh.
as a social worker, that's
It's great.
that's so
Huge win.
good,
Yeah.
they have created really good cohesive groups. So
Well, we do want to accommodate that grouping, especially since we're getting them and it's catching
Yeah.
on. So
I may
can
have
you
to do a
like have
second,
2
yeah.
sessions?
right,
or-
I may have to do a second day.
Well,
This group-
whatever you need.
Thank you, yeah, because we use your library. I may have to do a second day. This group is it. They are not going to be splitting up, but yeah. It's nice to see, and it's nice to see there've been a couple smiles instead of all tears and stuff, and it's nice because no one wants to grieve constantly with their friends, because their friends are like, you told us. You told us that story. So this is a safe place that they can repeat themselves.
And we do have a bereavement group in Wilton as well. And some New Canaanites go to
They
Wilton
do,
because
yeah.
it's new faces and it's not the same. They can be a little bit more, not less guarded, I would say, when they're talking about.
Don't
So, I'm happy to work with you and put more programs together because it continues to be a need. Our Navigator group is one that's, they're getting together at bereaving because their spouse has Alzheimer's or dementia. And so they're grieving in their own
Right.
way.
Long goodbye.
So you put all those, pieces together, and I think it really helps having a group session like it does in so many other things for support. And they get together and they go out to dinner together now, and they
Yeah,
feel like they
it's
have
nice.
somebody they can share
Right.
you know, what they're going through with that's going through it with them, you know, they're experiencing the same thing. So it becomes a very healthy
Yeah.
environment. So I just think that's one of the things.
You know,
that
I
should
liked
continue.
I like having an open group, because the newcomers can see the, you know, the older folks, like, so there was one woman who said that she had a very good friend visiting for a week. And she's like, I hate to even say this, but like, I was ready for her to leave. Like, I've gotten used to like my like new routine of like, I like being alone. She's like, I hate to say that, but like, I've learned how to like be alone. And so she's like, you know, it's like
Do you have that?
long a visitor.
Do you hold that at Waveney rather than Lapham?
I hold that at Waveney.
Is there a reason you don't?
We were trained through the hospice. I got certified as a grief counselor, and then we were trained as hospice volunteers. And my schedule is just too busy to be a hospice volunteer, but who runs all of those volunteers?
Daniel, we
Yeah.
have so many, we have
Daniel,
Stella Clark, we have Daniel, we have.
So Daniel
Ministries.
asked if like I
Oh.
would do a group, and
Nice.
so
So
yeah.
we bring them in, we train them, through our hospice, program and our grief program, and then send them out because we know, you know, there's these small groups, 11, some, you know, we can have 20 at Wilton, and, it's just very important to give them that support.
Do you need someone? Because Marcy's too busy to do it.
No, I just said to Marcy, you know, we have the resources that we can make available to her. If she sees the need and demand growing, then, you know, I can always take someone from our clergy staff or hospice or whatever and augment, if you will, whatever she's doing and make sure she's aware of it and you can coordinate it and all of those things. So we're happy to
And
do that.
Daniel's been really good about, he does like a quarterly
He
like
does.
Zoom just to see where we all are. And so, you know, if I find that the group gets too big, I'll add a second day or something. I can talk to
Just
Daniel.
just let us know. We're happy to.
Just to call out the, that connectivity theme we've been talking about. These kind of things are so
Right.
powerful. I think Russ is right on. This is like for us to think more systematically about, because everybody, in a lot of circumstances when people need other people, and I think it's the most therapeutic thing there is. And I mean, just listen to you, I'm just reminded of, you know, what Gail's been talking about, so.
Yeah, I mean, everyone needs to feel a part of a community.
Yeah.
You know, even if it's a community of like 4, like my daughters went off to college. I'm like, look, you literally need 3 friends. Like, just like, you don't even need that many, you know, you just want to know that you're like part of something.
Yeah.
That is,
That's it?
that's
Okay.
it, yeah.
Thank you, Marcy.
Excellent. Do you want to get the other thing or no?
I sent everyone a message. That was part of old business.
Yeah,
So I,
well,
yeah,
we're gonna bump into that on our way down.
you got it.
Way down the agenda. Okay, old business, agency liaison, any updates, reports, et cetera. So Alyssa, there's a domestic violence function and was it September 18th, 4th? No, the October 4th, yeah. So that's the Friday night after our next meeting, if anyone's interested. I did attend the Kitchen Crisis Teen Talk Summit and you weren't there, were you? No, Jackie was there. I know Dr. Lutzy was there. It was in Darien. It was very impressive. The whole town, the superintendent, et cetera, is involved in this, you know, reflecting somewhat the need, the felt need and perceived need after the suicides of, you know, 2+ years ago, whatever. But they have contributed a lot of money to the Kids in Crisis. They have, they've started a Kids in Crisis counselor and teen talk counselor in middle school there. There is money, their money comes from Community Foundation as well as the opioid reimbursement. So it's a flourishing thing, and they are going to do the same thing in New Canaan on September 10th. It's in the library from 10 to 11:30 a.m.
Is that
No.
open or is that,
Just next week?
Yeah.
does anybody attend or is it?
Yeah, it's open. Yeah. It's, yeah, New Canaan Community Foundation sent a notice out about that, and I think it should be in the paper, Kids in Crisis notifying people, so
Sure.
it'll be in our minutes, right?
Yeah, there was an email that went out on it.
Next, the priorities.
I'm
So,
sorry, I just had a quick urgent
Yes.
assessment.
Yeah,
Update in that the volumes continue to be about the same. A little bit of Weston and us. All the other data is pretty much the same in terms of the presenting kind of symptoms and gender and age groups. It tends to skew a lot younger. Kind of interesting update is that Silver Hill has had a couple meetings with Westport, and they trialed a couple of cases with Westport, and now Westport's trying to figure out if they're going to do something. And there's also some discussions with Fairfield. And there's a proposal in as well, so.
Oh, we should.
It's basically, it's continuing forward, they're continuing to work on evolving the program. Again, volumes are the same, but a little bit of movement on new towns, which is certainly financially
to get Westport involved would be major, although there's a plethora of therapists in Westport, so I don't know how that would work out long-term. There were only 4 patients at urgent assessment in August, I think, correct? Do you know that?
No, there was 10 New Canaan, 2
Okay.
Weston. And the numbers are still, it's 85% over the last 9 months, New Canaan, 2.8% Darien, and then just little, one.
One of the things that I'm looking at the data, and I don't want to, we should just put it in the back of our minds and think about it, is some of the financial assistance expenditures and the numbers and the evictions that are occurring. When things like that type of economic hit happens on families, then it usually puts kids in crisis. It usually has other impacts in terms of substance abuse and DUIs and things of that nature. I just think that there's some great data that you guys produce. And when I looked at the evictions, that Excel spreadsheet, did you guys see that? I mean, the evictions in town were just really, I don't remember seeing them that high. And when I look at the financial expenditures for rent needed and for daycare, I mean, those are significant. So we all have stressors in our lives, right? And I think as a community, when you see some of these economic flags start going up, I think it then rolls over to adult protective services and child protective services, kids in crisis and everything. So I think we just should be aware of that. It's a huge number for evictions that I saw, and also for the financial assistance requirement.
Can I just ask a follow-up question? What is, you have renters facing eviction that says % with counsel. Is that an attorney or is that?
No.
It's an attorney, so they're helping to facilitate it?
Right? Did I think that?
Well, it's
Yeah.
So they can afford a lawyer?
separate spreadsheet. Did I forget?
So it has,
Okay,
it's
that-
Excel spreadsheet, it has New
Yeah.
Canaan, it has 90 eviction filings.
That course of a year?
Yeah, what period of time is that?
You guys.
The range,
The date range.
the date range is in the bottom in red.
Oh, sorry. there
So
we
you
go.
see 1-1,
It's over 4 years.
It was, sent-
So
I think,
we're-
Jen, did you send it? You must have.
Yes,
sent
I
Jen
came
sent it.
over.
It came from the
Like, did I send that?
Good, no, it was, I thought it was interesting. I'm glad, I forgot about it, but.
Because it's always been a concern too in the past about
Yes.
human services role with evictions, because
Yeah.
they have to pay to move stuff.
We do, we have to
store it,
pay for
and
storage.
Blah, blah, blah.
Right.
And I just thought the data was pretty eye-popping that ours is so much higher than Westport and Darien, who are on the same economic playing field, if you will.
Although it's interesting, we only had one eviction last month
That you have
that
to pay
we
for,
were, yeah, that we were made
that you had to
aware
pay,
of.
yeah, that you had to pay.
But usually like the marshal will call us and tell us.
Right, it's just,
Yeah, but it's
if
good.
those numbers keep going, it
Yeah.
could potentially.
Well,
I mean,
more.
you think about Darien and, I'm not that we're twice as high as Darien, but it's
Pretty close.
it's pretty high. And so I don't know, again, in drilling down, is this related to our workforce housing? Is this just, there's a lot of homes, a lot of mansions that are being rented. So I didn't know how to tie what's happening in the economy and what's happening in the local economy to how it manifests out into human services and health issues. So I just think we should just keep our eye and track on those going forward.
But meanwhile, you only had 2 last month, right?
That she's aware of.
That we had to pay for and that we knew
Okay,
about.
so that's
yeah.
an important distinction. Like how do
Yeah.
you get to 90? in
Right,
4
so
years?
what, that's why it's important for the state data, because, like when Bethany was always presenting her, that's only the evictions they see and they get and are financially responsible for. But it's not giving you that context that there's 100 other ones going on. And to Russ's point, then you have entire families uprooted and these other things going on. And how does that play into domestic violence, kids in crisis, and everything else?
That's really good,
Yeah, I think
really
it's a-
good point.
I think it's a super important call out, Russ, because when we looked at the priority thing, and this is some new stuff I'm talking about, but one thing that really wasn't in the priorities was the safety net stuff, which is the root of human services. And, we had connectivity and, mental health and all that, but, the emergency preparedness, but we did not have this broad category of safety net services.
Well,
And
yeah,
I think,
that's-
and they've got to be added back into the
Well,
priorities.
that's sort of
'cause-
what I kind of said in my sort of greeting, is that that's why we have to be so cognizant of where we do spend the money on those priorities, because, the criteria for our clients is financial. So there will be a financial strain on us, and we are giving more for rent and that kind of thing. So that's why I think we have to be very cognizant of like.
And Martha,
what's
could you
the-
unpack that more? Because that's a really big statement, because I did
Yeah.
not realize that, because the suffering we see is everywhere.
Yeah.
It's not, some of it's socioeconomic, but most of it's not.
Right.
But
Well,
is
for
that
a lot of it is in.
That's my
in-
question,
in
is
our
the
department.
guidance that you have, and then what we're looking at, is there a financial need overlay that we have to
Well,
consider?
they're all, yes, they're
When we're
all,
looking at our budget
course,
decisions, because
right.
that's a big deal, as opposed to, let's say, if there's huge suffering in the town, 8% of the people, right, and
Uh-huh.
on some issue, but
right,
there's not a financial need. Does that mean we're gonna be directing
right.
the money more to the 20%? And I'm not judging, it's just a
Right.
question. I could see it from both sides, but I actually,
It's just something, and we don't know what our budget will be this year, but it's something that's always got to be on our minds. Like, we have back to school programs, things like that. Like, we spent $7,000 just on giving gift cards to parents to get school supplies. So we spent almost $4,000 on rent help. And those comes out of our, coffers. So we just need to know, like, we don't know what this year will bring as far as like financial need, but our food pantry numbers are up.
right,
Our client numbers, they may not be jumping sky high up, but I get 4 or 5 new clients a month. That adds up. And, so like, if we need to help with an electric bill, I have 218 clients. So if I have to help with like 50 electric bills, or
because this is actually really, really helpful to me, because I think the core of your work and the department tends to be those in need financially who have kind of these other issues. And I'm wondering about like our overall purview, because the human services department is a thing, but the issues are way beyond that. Russ, do you see what I'm struggling with?
Well, I do, and I to narrow it down a little bit, I think we have all this data and it's great, but if we could just we have so many community services and programs that help certain people, behind the scenes quietly. But if we could somehow pull those 12 nonprofits that are out there that are working together and say, what are you doing? How much are you providing for, I'll just give one example, and this is not breaking any HIPAA violation, but in our assisted living facility, we have 8 New Canaanites seniors who have Alzheimer's dementia, and they've run out of money, right? They're widowers, and they have, lived in New Canaan and have used all of their money and resources. And if you look at just the charity, we were looking at this yesterday, if you look at just charity care, and this is not taking uncompensated care, the difference what Medicaid pays us versus what our costs are, we're spending, $1.5 million on charity care for seniors because they've outlived their nest egg and their savings account. That's a huge number. And I think you take, Waveney Life Care, you take Get About, you take some of these where we are really truly assisting, you're going to find that a lot of these nonprofits are putting a lot of effort and a lot of money into it. Meals on Wheels, as an example. And then what you're doing is part of that safety net. And I think to Peter's point, understanding that safety net and now knowing the strains that's going to be on that safety net are growing. And I just think it needs to be acknowledged. I'm not saying we have to come up with a solution, but numbers, you guys know, and I'm a numbers guy, numbers are impactful. Kids in crisis, how many, kids can't afford, parents can't afford, or insurance only covers them for 3 visits and they need 8, right?
Yeah, the 3 speakers that had in Darien were teens at Norwalk schools. They were inner city population. They were African American, and a mix. And it was clear to me listening to them that Kids in Crisis was their source. Their living environment is scrambled, somewhat unpredictable, and it was just a component of what we're talking about. And the bottom line is money too with this, and what happens with our budget, continued cutbacks, et cetera, when the need seems to be going up.
Right.
So it's a TBD.
Has our school system hired a counselor for SACS?
From what I understand, there are 2 new social workers.
Okay, great.
I heard that from Jackie today.
Okay. Yeah, we're looking for a counselor to replace the Kids in Crisis person.
We still don't have someone
As of a
doing that.
couple of weeks ago, they hadn't had one.
Yeah.
Now they do it.
Yeah, it seems like Jackie said that there are 2 social workers with SACS. They are, I guess, from what I understand, is SACS now split up their
2 schools.
grades?
It's
It's like
2
2
schools,
schools,
basically.
right? So there are 2 social workers for 5th and 6th and 2 for 7th
That's the way
and
the
8th.
nursing,
One for each?
that's the way the nurses work. There's 5 and 6 and 7 and
okay.
8, which is interesting,
What's the biggest middle school in the state?
Yeah,
Is it really?
We got 5th grade in there too. Right?
yeah.
Sometimes. it's-
Yeah, they're kiddies.
Yeah. But there's still the need for the Kids in Crisis counselor in addition to those, right? Is that
Yes,
the sense?
that
Okay.
was the trade-off.
Oh, they hired a social worker. So that will still be the biggest part of our budget? The Kids in Crisis, the teen counseling? Excuse me, yeah.
Yeah, well, it depends on
Biggest.
what,
Yeah,
right now it
depends.
is.
For the high school.
At this conference, did they talk about the need for junior high programs vis-a-vis the senior high? We've always spent our time on the senior high.
No,
but
well, what they did, they
in fact-
instituted the middle school teen talk counselor. That was new. It did have a high school teen talk counselor.
But generally speaking, that communities of Fairfield County have recognized the need for a kids in crisis counselors in the junior highs. Is that a fair statement?
Yes, it probably varies by community. But Darien is, mental health is their focus. And they're doing, this is a subset of that. They would like to have them in elementary schools, and some people are gravitating, some towns are gravitating that direction.
Because I was involved with a national group that spent its time focusing on keeping minority kids in school, in high school. What they found was the problem of the disease, as it were, of school dropouts generates itself in junior high. So that was a major shift of strategy. But again, it takes a while to make that happen. And I didn't know whether kids in crisis, which has always been heavy in the senior high for us anyway. It sounds like it's now being recognized as an ongoing problem. And is the Board of Education going to pay for the SACS program? Do we know that? Have you had any conversations?
They're paying for
They're
the
paying for the
social
social
work.
workers.
Their own social work.
Their counts.
As long as,
I think before we go down this rabbit hole again, if Jackie could maybe just write a paragraph
Yep.
for us to say, here are the coverages, this is whose budget it is in, this is what may be left for us. I think that would be, or these are the open positions. I think that would be very, very helpful as we're talking through this, especially if it becomes a budgetary issue again.
And she's very open to like, that YSB grant. She was giving like little bits and pieces to different organizations and different activities. And she's very open also. That needs to be that she gives half to kids in crisis and half to.
It would be
CARES or
nice,
something.
yeah, it would be
Yeah.
nice just to see the whole picture
Yeah.
and then be able to make recommendations based on that. If she could do that, I don't want to add
Sure.
more work, but.
while we're on the topic of middle school, I just wanted to pivot and talk about phone-free schools and see if Raquel could tell us a little bit about that exciting article about what's happening.
Yeah, no, I mean, it's pretty great. So the middle school is going completely phone free. I think it's launching hopefully within the month.
Right.
They're getting pouches that the kids will lock not only phones in, but watches as well,
All right.
just from the distractibility of, constantly checking your watch. And so from being able to focus and engage with your learning, that's the thought process there. So that's kind of the hope on the school's end. And then it's the phone-free school initiative, from what I understand, is not going to be in the high school at this point. I think the Board of Ed has some ongoing discussions on that. But right now the focus is on the middle schools and kind of creating that environment that's distraction-free there. There's a parent group that I'm involved with, New Canaan Unplugged, that we're kind of trying to help parents think about alternatives to technology. And so that's, one option, or whether, I guess, I shouldn't say alternatives to technology, but technology that's potentially healthier from a mental health perspective and a distraction perspective. So things that effectively aren't smartphones, but rather going back to flip phones or, whatever else.
Or
ways of
a
communication.
post-it note on your
Yeah,
book,
yeah, yeah.
just to remind you what to do.
Yeah.
Right.
Well, I was going to say, they're not going to be able to read the analog clocks. So I don't know what they're going to do, because they go like, see
Yeah.
what time it is.
They could use a rotary phone.
One of the things that's interesting is the communities directly around the schools, I think, are less concerned about technology when you're within close walking distance.
Okay.
People who live further out are worried about communicating with their children in terms of things changing. And so one of the other things in terms of the split, from what I understand of the intermediate school and the middle school now, is they are bringing back the dismissal manager software. And I don't know if any of you are familiar with this, for 5th and 6th grade. So in the elementary schools, we have an app on our phone where we can say how each kid's going home. And if that changes during the day, that's how we communicate with the school. Actually, I'm going to pick them up versus
Oh, wow.
they're taking the bus. And so they're reinstituting that for 5th and 6th grade so that the parents who have the concerns of, well, what if something changes and I need to communicate with my child? They'll now have an option. So with the hope of like, you don't have to be as reliant on technology. So a lot of cool
Well, and I liked
things.
what I read, that it was, you're not gonna get all these notifications all day about stuff that's irrelevant.
Right.
And you can focus more on social interaction and not be distracted by it. I think that just makes so much sense.
Absolutely. I think some of the schools, I want to say it was the Washington Post, and we might have chatted about it at some point, but a school in Connecticut who had gone phone free, they saw bullying go down. They saw, bathroom trips were a lot shorter. As kids were sneaking away to text or whatever, or whatever.
Test scores go up? The kids actually perform better? Do they know yet?
It's interesting. There's studies,
Question.
I don't know if about from that school, but there are studies that show your performance improves depending on the distance you are from your device
Oh.
and your accessibility to your device. So if your device is on your desk, you perform fairly poorly. If your device is in your bag, you still don't perform as well as you could. And if the device is in another room or locked somewhere, your performance goes up.
You drop right now.
I know.
Rather texting during his son's wedding.
So it's pretty interesting. It's a lot of that data is actually in Jonathan Haidt's book, which
Yeah.
has gained a lot of popularity in the last year.
Well, congratulations.
That's
You
great.
really
But,
have-
sometimes have had, as you know, some towns have had
Difficulty, but it wasn't the children that were complaining as much as the parents complaining that they needed to be able to get in touch with their kid.
Well,
And
Right.
We've got a solution
and-
for that. That's good.
yeah,
Well, I thought I read that they're gonna have pouches in the classrooms in the high school, and so you have to put your phone in that when you walk in.
Correct. I think they have caddies on the doors.
Caddies,
Yeah.
Yeah.
And then they said, well, the teachers have to keep their phones away, and they said, yes.
And I think there's a cultural shift there too, right? It's like when your students are taking tests, like how do you not fall into that temptation too? I mean,
Yeah.
one of our kind of hopes as, again, that parent group that I'm a part of, Nikkei Unplugged, but is kind of how do we also for ourselves think about tech in a healthier way and reduce our distractions, especially with parenting. I don't know if you guys saw the new Surgeon General report on parenting being detrimental to your mental health and your overall health, which is kind of interesting and fascinating. I haven't fully dove into the report, so yeah. But
That's true,
a lot of it is around like navigating technology and
the
kind of
stress of it.
and the stress of it,
Yeah.
and that includes for ourselves.
Mhm.
And so
No, good, it's great.
Thank you for the ammunition for grandchildren, especially one, the distance and the performance.
Yes,
Yeah.
that's very good.
it's interesting.
Okay, let's move on to, so I don't know how much time we want to spend on priorities. We have them, there were two. Peter and Barb did theirs, Marcy did hers. Want to take 10 minutes and discuss this and
We
then,
can, it's just, I really did it for food for thought, so, so we have kind of an idea of where we need to really concentrate when we do know what we're working with. We don't know what we're working with right now. And I think that we're just going to, if our mandate is what it is, we're gonna have to figure out what to give and where to give that. And I think that we do need to just sort of focus on, besides, the impact on our department and our own finances and getting to the needs of our residents and our direct clients. Mental health programs and suicide is gonna be important. Kids in crisis, that doesn't mean the actual even Kids in Crisis program, it just means, kids in crisis. And then senior isolation. And so I think those are the three that we are seeing as being priorities in our department. And we just sort of have to figure out what organizations are going to do the biggest impact, and where we can make the biggest impact. In helping them.
Talk to me for a minute on the difference of the kids in crisis versus behavioral mental health programs? Where are the
Well, the
differentiations?
mental health programs are for all ages, you know,
Right,
adults and
yeah.
seniors and stuff, and the kids in crisis, it would focus more on kids and
I just have a question about seniors, because having been in the business, I feel like there were a lot of good resources available. And you mentioned Meals on Wheels and Get About and Staying Put and LAPM and I think it's obviously it's important. It's your whole bailiwick, but I do feel like maybe they do seem to be a lot of good things in place. And we also talk about how you can call somebody and say, how are you? And they'll say, don't come to my house. Don't, I mean, they may be isolated, or even your bereavement group. I just wonder, you make it a priority because,
I make it a priority because it's important that we not let isolation become a bigger issue. So like
okay,
Get About and Meals on Wheels, those are really important organizations that do alleviate the isolation.
right, just
you know, so
picking
like-
somebody up and dropping the meal off and
exactly.
chatting, yeah.
So that's why that's a priority, because if those services were not in existence,
Okay,
there would be people.
so it's just the value of supporting them, financially supporting them, okay.
But do you think we need more? In other words,
No,
even though
no.
we have a lot.
No, I
Yeah,
don't think
that's
we
my
need
point,
more.
yeah.
I think though that it's got to stay a priority. I
But
don't think it, like, we should be like, you know what? Meals on Wheels has got a great amount of money and we're good with that. And it's not, like, I think I think we need to think about what helps with isolation, those two programs.
Right, so you're talking about the funding, not so much that it's the critical issue that's not being addressed. It's more, you want to make sure that it
Right.
continues
So
to
when budget time comes
supported.
around, we
Okay.
have an idea of like, why.
Because I think framework is really important, because if we think about commission priorities, those are a little more long-term, and those are sort of more thematic. And I tend to find that the issues that we have do go across almost all populations.
Mhm.
And so that's kind of the framework we had kind of used. Now, budget is a separate kind of discussion, and this gets to Russ's important point about like, where's the money flowing from all around? And what does the town need to do? Because for me, this is very powerful
Right,
as we look at budget
right.
now. And I mean, this is the food for thought for everybody, is if our overall priorities are a little broader and a little more catch-all, like take connectivity, mental health, and the safety net stuff, and then emergency preparedness, which is why I always tracking the health and stuff like that. I think these things hopefully, if we get those bigger priorities right, these things tuck in and will probably inform. I mean, this is what will inform our budget discussions, and I'm trying to pull the two things apart, and because I think data will support what we've been talking about more thematically, but probably also support what we need to fund this year. Because this week is very true to me, like as the budget discussion kind of comes, but I'm just trying to pull these two things apart because they're different. Because we theoretically are trying to provide guidance for everybody, including the foundation, right? Including philanthropy and stuff like that. But then what are we actually going to spend? This is where like Deanna's going to get very involved and
Right, and those are
kind
questions we
of
need
Board of
to like
Finance.
ask ourselves, like,
Right.
is like spending $5,000, giving $5,000 to an organization really, where we could give like 10,000 to something else that would help with.
Right, so it's impactful,
isolation.
especially those
Is it
big
impactful
organizations.
To give to like 12 organizations, or is it a better idea to give to like 6 with like a larger amount that really will make an impact? So it goes.
And I think, Rachel, and I think you and I talked about this at our last meeting, was how far upstream can we go? I mean, we're getting ready to have, we're in the middle of the gray wave, right? So you're starting to see even in New Canaan, 16% of our population is going to become 18% of our population soon. You have people that use our resources, right? You have people that use Get About, you have people that use Meals on Wheels. You also have people that are just home alone and isolated that don't reach out at all. You have people that go to the LAPM Center They use the resources that are available to them. And then you have people that don't at all until it's an acute care episode. Now it's a 911 call or a neighbor comes by and finds them. Now they are in the hospital in the acute care setting. Now we're providing subacute care services. They're out of funds and now we're the safety net. So I personally like going upstream as much as we possibly can. I think it's more cost effective than to have to take care of a resident for the rest of their lives. And that safety net to provide that. And I think that we do that with kids with crisis to help educate people. Okay, here's some signs that you need to look for. So I, for one, and I agree wholeheartedly with what you said, Peter, and in finding those trigger points. I think the economy is a trigger point. And so what, if there are no socioeconomic groups that are going to be impacted by there, then how do we have this measurement or educating the community so they, you see something, you say something. If you have that elderly parent or you have a child that acts up a little bit, that okay, something's going on, I need to at least address it because we've educated you on as a parent, right? Especially first-time parents, especially parents where you're, both parents are working full-time, right? And they may not see that small change and they're under pressure to get into a great school and be A players, A performers on every level. That comes out in either a suicidal ideation or some other way. But I agree, and I think where our selectmen are going is let's pick those 2 or 3 things, make the recommendation, and then let's try to move the needle on those 2 or 3 things. And I think as far upstream as we can get, I think helps us in the long run. Because for those of us that are the safety net, the catch-all, when it all comes through, that's straining the net, right? As compared to trying to do something further upstream, if that made any sense at all.
Yeah, I think it's important, and I think worth lots of discussion what the philosophy is of like big chunks versus smaller. We make all kinds of argument on both sides, and I don't think we're clear and have not really been intentional about that. That might very well be the way to go. And then this balance between the upstream and the urgent stuff, the answer is always usually a hybrid balance kind of a thing. And I worry about just jerking the wheel one way or the other when because things are the way they are, because for a lot of reasons.
Yeah.
I mean, I just know like in business, sometimes you walk in and you go, this is dumb. Why are they doing that? And then you're around for a couple of years and you go, I see why it's that way. And I think, how do we take all this stuff into account and try to be as measured as we can be to balance these things out? And I think we've got time, and I think we've got a first selectman who's open to adjusting what has been a little bit of inertia, like year after year, we kind of do the same. And I think we're all open to
Right.
a relook, using data and.
Look, I'll leave it at this: support groups and from Marcy's perspective, and I think a lot of our perspectives work, right? They've worked in AA, they work in bereavement, they've worked whatever, and that is a very low cost upstream way of providing support education to prevent that acute care episode.
And how do we manifest that? Other like educating, I think is really important. Some seed money to anybody who would want to get those things going. That gets very interesting. But I think this is really powerful and just good to know, unvarnished. This is what I'm seeing right now, because that's a huge factor
Right.
For what
And
it's
for all
worth.
of us,
The
But
only
it's
thing
worth
I'll
over
add,
the years, basically, the human service, health and human service always have worked cheek by jowl. And sometimes with and without the foundation, the fact that there's now a partnership evolving that puts somebody, or a dialogue in place, I guess I'd say, for the two of them, because it's gonna have, the town is not gonna be able to cover all the costs, all the things you're talking about of the following the stream and where the ROI is on all of those pieces. The fact that you now have Lauren and the foundation board involved, I think is gonna be very helpful. Not only helpful, necessary. you know.
And the results of the research, right, are gonna be
Yeah,
very,
the
very
data.
helpful in informing what we do,
Data
but I
from
think
the survey, yeah.
your point is really well taken. These all fit within the priorities we've talked about, but these are more related to the funding, but we just want to make sure that we're really embracing all of these as we go through
Yeah.
and determine our priorities.
Yeah, the only thing I'd add to that, and it's not new, but it's substance abuse. So
Mm.
of the New Canaan urgent assessment, so 13% of those that are going there have a history of substance abuse, and maybe more not. Silver Hill is going to send out a questionnaire because they want to define this better. Bethany told me that number, and with 13%, I was on a committee, 20 years ago, whatever, that looked at all the schools from Bridgeport to Greenwich, all the high schools. And there was a 13% number of those using substances,
Huh.
alcohol, marijuana primarily, but hard drugs too. So that core number was kind of interesting to me. I think all of this is great, and it's good. We've discussed it, and we're going to have the survey to give our information. And hopefully what they get from the survey is going to be directive in terms of what we do, what we're not doing, and what we don't have to do anymore. I'm not sure much of that. In terms of also where the monies are going to go, because there will be data to suggest this and put a little pressure on the finances of New Canaan.
Tom.
So we want to be involved in the decision. They want us to be involved. So the two dates here for the
The
New
foundation.
Canaan Foundation is moving with, so they're public sessions. One is September 16th, which is a Monday, and it's from 1 to 2.
Yep, I'm going to that.
Okay, the other one is on Tuesday on the 17th of September from 6:30 to 7:30 PM. First one's in the library, second one's in town hall. So I did speak to Lauren, and we have an option as a commission to meet with them separately. They would do an hour with us after the Monday or after an hour after the Tuesday. I wrote back, she didn't respond. I said, if we can't get enough going to one, maybe we could do a half an hour after each. So I know you don't have your calendars in front of you, some of you tech people do, but what do we think? Is there a consensus for?
Well, I was gonna
Dr.
say,
Pierce, the only thing I caution you, if you all need to become a quorum, it needs to be advertised and posted as a public meeting.
Okay, good.
Unless only one party.
They're going public with this.
I'm just telling you, if it becomes a quorum, you have to follow the
We'll keep
legal law.
it one less.
Well, I won't be here. Would it be possible to do a Zoom with them or something would that be a meeting
It's
too?
still a
It's not a
meeting.
meeting,
Right,
unless
right.
it's one party.
Oh,
You can send out an invitation. People can go as they want, but if we all, if we have a private meeting with them, that's different. So I would just suggest we all try to attend one of these two meetings
Or
and,
one of the two public.
yeah,
'cause
and
the vendor
make
is
our
gonna-
information.
the vendor
Sorry.
of the person who's
Yeah, we
designing
should
the
probably
audit
list
study.
Before I make a motion to adjourn, which I'm known for,
You're good at that.
I'm really good at that, right? The closer is what it is. What is the timeline for when we have to send out the request for funding so that we put a narrative together and say, here's the priorities. We send it out to all of your nonprofits and everything. You said, if you feel you can meet the needs that we're expressing, please file a grant for that. What is the deadline for that? Because isn't that like
We
November?
used to do it November, December, and then we thought we really needed more discussion. We'd bump it up to September, October.
Yeah.
But, with the change, et cetera, and we're following Marcy's lead a little bit with this.
Okay.
In terms of when she gets the information.
Okay.
The grant proposals have been sent out, I presume, right?
Yes.
Okay.
And they're due
So we
back.
can deal with this next month.
Okay.
I do know the timing on the survey,
oh, good.
and there's still all this great work they're getting input from everybody. They're refining the questions, the language and stuff like that. We'll have our opportunity. They're going to be in field in the month of October. And the results will be available December and January, probably
Correct.
published formally in January, but I think they would give us a
Preliminary,
preview in December, because for me, I would love to have that before we, just as a huge input to what we think on the budget. And I don't know how exactly to do that in terms of the budget flow, but
The focus of obtaining information is directed more at the adults for the first 4 months or so,
Correct.
right? And then,
Correct.
then next,
And then.
Children follow.
winter, spring, or is youth. So.
But we'll
you know, I
probably
don't know
learn
how
a
that
lot
fits
about
in.
the children from the parents, right? I mean, what they have to say,
Yeah.
that may be helpful.
Anything else, Mr. Chairman?
Wait, can I have one, I have one other question. Do we know when we would know what your budget will be? Do we have any expenses?
We meet in December with the first selectman and then January's board of selectmen.
Right, but I'm just saying, so you,
Well, you propose it to first selectmen, so you select it and then you meet with them first, the first selectmen.
$500,000, I'm proposing.
Oh, you can put anything you want.
Well,
It's
should
just immediately will
we, should we try and be
cut out.
realistic about it?
Well, it's a little bit of a new game, so I think, Marcy, if you could just get that basic
Yeah,
information, then we'll
Just
go.
talk to her and see what she's thinking, because that's gonna inform what we do. We hate to come up with this great plan and then, oh, you only have half of what.
Right.
Yeah, what percent, yeah, what it's gonna look like versus last year. She'll tell you. Yeah,
Motion to adjourn.
exactly.
All in favor?
Second.
Opposed?
Russ.
I have to have a